Hello, everyone. Little late, but not very late. This is the 10 p.m. class, and today we are going to discuss about some MCQs. So, usual lower limb MCQs is what we were discussing all these days. So, we are going to do little bit different because we have been doing this lower limb for past 2-3 days, and we got the hang of it. And all of you have been answering great. And I thought I'll just switch to head and neck and see if you can recall anything from there. Me, Dr. Rohini Vine here. And, this is my schedule for the month of June. Actually, we have special classes 8 a.m. actually every morning, and then YouTube classes that is 7 p.m. and 10 p.m. So this 10 p.m. class is always there. That is, I come up with the quiz. Now for today, it is not lower limb, it is head and. So just, go back to your head and neck revision classes and see what you can recall today. And then this is the agenda for the month of June, and we are able to cover up to 25 to 30 questions in a session, right? That is one good target actually what we have. So this is basically the MCQ based question. So we have things that is coming up for this next few days in this week. We have this histopathology is just what I finished today at 7 p.m. This is actually a wonderful topic. This histopathology, normal blood vessels, tunics, all that we learned in the part 1 and part 2. Right? And today's class was basically the part 3, where we had histopathology, talked about aneurysms. We talked about what is the talked about aneurysms. We talked about various other conditions, and that will create issues with the walls of the blood vessels. Like it could be inflammation, or it could be aneurysm, or it could be any other genetically involved syndromes which can cause effect on the, or it can have damage on the blood vessels. So all this we have discussed. Then we also have this neuroanatomy that is coming up in the same week. Have meninges lined up for you. Spinal cord part 1. Like that, I have spinal cord 2 and 3 as well. The spinal cord 1 will talk about the general things about spinal cord. And then second one will talk about some tracts. What tracts, that is extrapyramidal tracts, pyramidal and extrapyramidal tracts. And then we'll talk about the other associated applied aspects with the spinal cord in part 3. So I have divided this into part 1, 2, and 3 for your convenience and understanding. This is what is lined up for you for the next few days. So limited time offer is going on right now. That is with the PG NEET iconic subscription. You have 36 months. You're getting for 58,500. Like 24 months is for 49,500 and 12 months is for 4,500. The first 500 people, students, are going to get this with the 10% discount when you use the referral code. Referral code is nothing but my name. You can use ROHINI. It is displayed on every single slide at the footer. So if you don't recall, you please go see the footer and it is there. ROHINI. It's a very simple name to not to forget. So don't forget. And this is the other amazing offer you have. That is 3+1. This one extra month will be immediately within 30 days. It will be added to your subscription. And that is also a very good offer. It is again limited time, which is going to end soon. And there is 12+2, which is again 14 months of subscription. That is almost a year plus 2 months. And this is a good offer in case you're planning to take the uh, exam in the next year. This will tell you exactly what is your preparation and how your preparation is going. You also have evening classes in case you don't have time in the morning. You can go for this evening June to November classes that started on June. So you have June, July, August, September, October, November, almost 6 months of course with all the best educators you can list. You can see this that there is this learners app that you can download for your special classes. You can browse for this app and then you can see NEET PG section where you can see the top educators. You can follow them and subscribe. You can follow and subscribe to my classes using this code ROAQUA. My name is Dr. Rohini, and if you want to use any referral code, please use this as the referral code. And all your dedications and the hats that we receive really motivate us. And thank you so much for all that red hat, brown hat, and the blue hats that you dedicate. Thank you so much. It really motivates and makes us do really good. And we are very thankful that we have such good students. And we'll be even more happy if we have good subscribers for this, because a lot of hard work goes into all this making. So we need good subscribers who are passionate about learning something nice. Okay. This NEET PG subscription where 36 months of subscription is just for 1,250 per month. So that is an EMI option available. And you have to have at least 6 months of subscription to get such a offer. And then you have 24 months for 1,500, like that 12 months for 2,063, and so on. But you have to use this referral code here as well. That is my name. Use this referral code and then you can get up to 10% discount. With all these things that is happening, you also have this one good news of getting Unacademy and Prep Ladder. Together you can club and you can get the access to all the educators. So this is a nice thing actually. So with all this, what we have planned for you today, that is the MCQs. Okay, so we have this nice MCQ that is lined up. Of course, you can definitely look at your answers here, but so these are the MCQs. Okay, we'll start with the first one. I'll pick some color that is actually different from what we have it here on the screen. And we will justify the answers actually. In fact, more than, identifying what is the answer, guessing the answer, you have to agree with me and we shall justify why this is the answer, right? Okay, let's see. Okay, we have Aishwarya saying good evening. Hi, Aishwarya. Nice to see here. What is the action of superior head of lateral pterygoid muscle on the mandible? Now, lateral pterygoid muscle has superior head and it has one more head. That is the lower head. Or you can also call this as upper head and lower head. It has two heads. What is the action? What is the action? The answer here says elevation. The options are elevation, depression, protraction. A and B both are correct, or B and C are correct. What is the action of lateral pterygoid? Anybody? See the lateral pterygoid, you remember L. Okay, you remember this L. Lateral pterygoid will do depression or lowering the mandible. But it will also do one more action, that is protraction. That is pushing the lower jaw, that is mandible, forward. So that is putting the lower jaw mandible forward, that is protraction. Protraction of the mandible and depression of the mandible, it does. So the answer, both B and C are correct. So this is the answer. The answer for the first one is E. Okay, let's go to the second one. What structure does the temporomandibular ligament attach? What structures does the temporomandibular ligament attach? Now, there is this temporomandibular ligament attached to coronoid process of the mandible, and neck of the mandible is there, and there is tubercle on zygomatic bone is there. Temporomandibular ligament, that is on the sides. You can see that it is on the sides. It is also known as the lateral ligament actually. The other name for this is lateral ligament. So it is more famous. This word is more famous than the other one, that is temporomandibular ligament, and it is more known. Lateral ligament is one of the key ligaments that prevents dislocation. Next one. So here the answer is 2D. How many bones does the viscerocranium consist of? Viscerocranium consists of how many bones? Viscerocranium is the one which is on the face. How many bones does it have? If you count the bones, you have facial bone, you have the nasal bone, lacrimal bone, mandible on either side. So you have frontal, all these bones. And then you also have the bones of the orbit plus the maxilla, zygomatic, all this if you consider, altogether you have 14 bones. So that is 3A is the answer. Next one. Which of these bones are unpaired bones of the viscerocranium? See, there are so many bones I mentioned, but there are bones that are not paired. Now here you have this facial bones, and then frontal bone is actually paired because in between there is a suture that is called the metopic suture. But mandible is a single one, that is unpaired bones. And lacrimal is again 2 on either side, maxillary also 2, zygomatic is on either side, as you can see, and there is palatine. Where is this palatine bone? Palatine is the one which forms the hard palate. So all this is paired except for the mandible, which is unpaired. Next, let's see the question. What kind of joint is TM joint? Now, TM joint, you know that there are condyles, right? The condyle is present. So there is a condyle, and what kind of joint do you think it is? Is it synovial joint? Yes. It is not a fibrous joint for sure. It is not a cartilaginous joint for sure. And is it a ball and socket? No, it has no rotation, right? It has no rotation. So it is not a ball and socket type of joint, but it is a hinge joint. That means it does flexion, extension type of movements. What is that flexion, extension type of movements? That is opening and closing the mouth. That is, it has all these actions. It has elevation, depression, protrusion, and retraction. But it has two compartments. One upper, another one lower compartment. What is this? It is the articular disc that separates. So this articular disc separates this entire joint cavity into upper compartment, lower compartment. So this is where the sliding and gliding type of movement happen. That is protrusion and retraction. And in the lower compartment is what you can see, elevation and depression. So this is the action of temporomandibular joint. So it can open, close and slide forward and come backward. That is protrusion and retraction. So that is called sliding movement. So sliding happens in the upper compartment. And elevation and depression happens in the lower compartment. This is a very, very important thing to remember. Next one, sixth one. Which of these muscles is responsible for elevation and protraction of the temporomandibular joint? So elevation is pulling it upwards and protraction is protruding it outwards. Which one? So elevation and protraction of the TM joint. You have masseter. No. What is the action of masseter? It is retraction and elevation. What is the action of lateral pterygoid? That is depression plus protrusion. What is the action of temporalis muscle? That is elevation plus retraction, same as the masseter. What is the action of medial pterygoid? Medial pterygoid will do retraction plus also it will not only do it's not retraction, it is 1 second. Not retraction, it is protrusion. It will do obviously the protrusion. It will do protrusion side to side plus elevation. This also will do side to side. It is like chewing. So lateral and medial pterygoids will do side to side movements like chewing. So what we have here, we have the combination of elevation and protraction. So we have to put those two. So protrusion and elevation is what we are picking. So the answer is D. 6D is the answer. Okay, so that is the answer. Next one. Seventh one. What set of movements below are correct for the TM joint? What set of movements are correct for the temporomandibular joint? Elevation and depression, protrusion. See the spelling here. Protrusion and retrusion. And this is wrong. Both A and B. elevation, depression, protrusion, retrusion, and bilaterally asymmetrical movements. So all this is asymmetrical movements is side to side movements. So this is also part of the TM joint thing. So it is not just one action that it is doing. It is not just doing elevation and depression. It is doing so many actions together. So the answer is 7D. Right? Next one. As we go to the next, questions, as we turn up the pages, we are going to get the questions more harder and harder. So the first set of simple questions are almost done, and we'll be going to the ones which are little harder later on. So we'll see the eighth one here. So let's see this one. Eighth one, the mastication muscles are innervated by. Now the muscles of mastication is derived from which arch? Arch is second arch or the first arch? First arch. Okay, that's also called mandibular arch. And which nerve supplies the mandibular arch? The arch is supplied by the mandibular branch of trigeminal. Okay, so it is the 8A is what is the answer. So this and its branches would supply obviously the muscles of mastication. It is not maxillary branch. It supplies the nasal area, nasal cavity. All the branches of trigeminal? No, that's wrong. Maxillary and mandibular both cannot. So this is the answer. And mandibular branch of trigeminal, that is 8A is the answer. Next we have, what plexus lie partly in between the temporalis and pterygoid muscles? Now we have good plexus of veins. They communicate with the cavernous sinus. And which one drains into the pterygoid plexus? One which drains into is the facial vein. Facial vein, it has connections with the pterygoid plexus of veins, and any infection on the face can be easily carried through pterygoid plexus of veins and reach the cavernous sinus to cause thrombosis. Okay, so that is C. The answer is 9C. Next one. What forms the floor of temporal fossa? Now, temporal fossa is the one which is above the zygomatic arch in this region. And what forms the floor of the fossa? You have to tell, is it zygomatic arch? Now it is here. So this zygomatic arch come into picture. There, zygomatic is on the cheek. So this will not come. Frontal, yes. Parietal, yes. What about temporal? That is also present in this area. So, yes. And always we have confusion with the sphenoid, whether it is greater wing or lesser wing. So always the one which is, expanded upwards like this as a wing or coming outwards is the greater wing. The lesser wing is a very small portion. Lesser wing is a very small portion, and it is actually known as the jugum sphenoidal. Okay, that elevation is known as jugum sphenoidal, and that is it. And then just below that you have this optic canals that are present, and so you can see all these things in the lesser wing. So this is what you have. The fifth one. So the answer is 2, 3, 4, 5. The answer for the 10th one is D. These are the bones, except for zygomatic arch and lesser wing. Rest of them are present forming the floor. Next one, what synovial type of joint is TM joint? Now we talked about the TM joint. We understood that it is a condylar joint, right? Is it a pivot joint? No. Is it only gliding? No. What is the example for pivot? It is atlanto axial joint, radio ulnar joint. This is pivot joint. Okay, this is the example for pivot joint. Gliding, sliding is between the carpal bones, the ones which just scrub and move. So carpal bones also, they are plain things. So now here what you see in the TM joint is gliding and hinge type of, that is open and close type. That is, this will do, and hinge will help in elevation and depression. This one will do protrusion and retraction. Next one, masticatory muscles come from which brachial arch? Now we have so many arches. Arch 1, 2, 3, 4. Don't have the fifth one, so we have sixth one. Which is missing? Fifth is not there. Okay, so this is wrong, first of all. So there is first arch, which is also known as mandibular arch. So muscles of mastication. The answer here is 1. Sorry, the answer is first arch. The answer is 12E. But what is the second arch known as? It is known as hyoid arch. And what do we get from the second arch? The muscles of mastication. And the third arch will give rise to, the third arch, what does it give rise to? Okay, the third arch will give rise to all those structures that is coming to form the larynx, thyroid, etc. There is a list of things. That is same thing with the thyroid, parathyroid. This is cartilages of ligaments. So first one is facial expression here. Second one, this is masticatory muscles. So we should look at which one gives rise to masticatory muscles. So that is coming from the first arch. That's why 12. Okay, next one. The facial nerve innervates the orbicularis oculi by. So now orbicularis oculi is one of the muscles of facial expression, right? So it is innervated by which branch of facial nerve? So you can see that the facial nerve has this 5 branches like this, like goose feet on the face. So you have the first one, which is called the temporal branch, and then you have the branch which is going towards the your ophthalmic branch, and then you have the upper buccal, lower buccal, mandibular, and cervical branch. Let's just list them. So this is the facial nerve. 1, 2, 3, 4, 5, right? 5 branches on the face. The first one is temporal. Then you have upper buccal, lower buccal. Then you have the zygomatic. You have the zygomatic here and then the upper buccal. Upper buccal, lower buccal. You have marginal mandibular. Then you have cervical. Actually, this is considered to be just one when it starts. So there are actually 5 branches. So we are talking about the zygomatic branch, which supplies at the eye level to orbicularis oculi. So this is the one. Okay. Next one. The skin on the cheek is innervated by. The cheek area or the chin area is innervated by. Now this area has a special supply from the nerve, that is buccal nerve. So skin, that is cutaneous. From where does it come? That is a question now. Other things are fine, but where does it come from? So now you know that the mandibular nerve has a trunk, right? And it has anterior branch and posterior branch. Posterior branch are all sensory. So you have auriculotemporal, you have lingual and inferior alveolar as the branches. I'm sorry, I'm blocking that. But this one has all the muscular branches to muscles of mastication. Plus, it has one sensory, that is this nerve, buccal nerve. Okay, that is what supplies the chin on the mandible. Let's move to the next question, shall we? Fifteenth question. So 15th question, which of the following ligament plays the most important role in stabilizing the temporomandibular joint? Let's move to that side completely. And which of the following ligaments play the most important role in stabilizing the temporomandibular joint? Now, I told you the one which prevents the dislocation. Which one prevents the dislocation? I told you the other name for this, that is known as temporomandibular ligament. That is other name for this is that's also called lateral ligament. So it covers the mandible and the zygomatic arch, the ramus of the mandible. It covers or extends from the say neck of mandible to neck of the mandible to the zygomatic arch extends. That is the lateral ligament. So the answer is 15C. Next, we'll go to the 16th question. Choose the one of the following alternatives that shows the correct route to facial nerve. Okay, where does it start? Where does it start? Now, You know that the facial nerve starts from the pons, right? To motor root and sensory root. Both of them join together and they start off reach internal acoustic meatus. From the internal acoustic meatus, they enter the facial canal. And they give branches, so many branches in the facial canal. And what do? From the facial canal, they simply exit cranial cavity through stylomastoid foramen. Then they come out through the stylomastoid foramen. And what does that do? Through the stylomastoid foramen, it comes out and then it enters the parotid gland. We also call that as retromandibular fossa. So that is what happens. So this is the one internal acoustic meatus. So that is 4. Then facial canal. Where is the facial canal? That is 2. Right? Then there is stylomastoid foramen. That is 1. And then it enters the retromandibular fossa. That is 3. So here the answer is 4, 2, 1, 3. Okay, 4, 2, 1, 3. So the answer here is the 16D. Okay, the answer is 16D. All right. Next one. Action of masseter muscle upon the temporomandibular joint. What is the action of masseter muscle on the temporomandibular joint? Remember, we talked where is the masseter muscle? It is actually present on the lateral aspect of the face. So lateral aspect of the face, it is present. And what does that do? The action of masseter muscle upon the temporomandibular joint. Now, the action of masseter muscle upon the temporomandibular joint, it does elevation and retraction. I mentioned about elevation and protraction. Who does elevation and protraction? Anyone? It will do elevation and protraction is done by medial pterygoid. Next you have, this is wrong actually. This should have been retraction. Elevation and retraction. So that is wrong. This sentence itself is wrong. Okay, so let's not take this. It's a wrong sentence. So let's not go with the wrong sentence. So we'll just call this. See, we should be able to identify the wrong sentences also. This is wrong. It is not elevation and protraction. It should be either depression and protraction. Elevation and retraction. So this one is the lateral pterygoid. Depression, lateral pterygoid. Elevation, temporalis and masseter. Depression and retraction. So which one will do depression, retraction? So there is no depression and retraction. Depression is done by the lateral pterygoid. It does not do retraction. So this is also a wrong sentence. And this is the correct one. That is, action of masseter is retraction mainly, and then the elevation. The first action is retraction. This is for masseter. Next one, so the answer here is 17E. Let's go to the next one. The next one says each temporomandibular joint has what? Each temporomandibular has, I told you it has two compartments, right? Upper and lower compartment. Upper compartment, lower compartment. They are all two synovial cavities separated by an articular disc. Articular disc is actually degenerated. Lateral pterygoid. So that is the articular disc. That is known as the synovial cavities. Okay, so this is each temporomandibular joint has upper and lower. So this is a separate synovial cavity. This is a separate synovial cavity, separated by an articular disc. Okay, next one. Which of these muscle is not innervated? You have to remember whether it is innervated or not. So all these negative words, you should remember it properly. So it is not innervated by motor fibers of the trigeminal. So which one of these muscles is not innervated by motor fibers of trigeminal nerves? So now here, the masseter, temporalis, lateral, and medial. So the trigeminal nerve supplies all of this except for the buccinator. Okay. So the answer here is 90C. Next one, the 20th one. Which bone of the viscerocranium contributes to greatest part of the upper facial skeleton? So which bone of the viscerocranium? Now we are talking about the facial, bones that forms the face. Which bone of the viscerocranium contributes to greatest part of upper facial? We're talking about upper facial skeleton. Which one? Frontal, nasal, maxillary, and lacrimal and zygomatic. Whenever two answers are given, there is always a debate. The one with yellow here, maxillary bone, is the answer. That is 20C. Because frontal bone also is part of the cranial bone. So it does not contribute 100% to viscerocranium. That's why. Next one, probably we can take up one last slide or one last question. Which muscles are active when the mouth is closing? When you're closing your mouth, mandible is elevated. What is the answer? Which muscles are active? So the ones which elevate the mandible has to be. So temporalis will elevate, masseter will elevate, and also whenever you elevate, you also have to retract. So this will do retraction. This will also do retraction. So these are the set of muscles which are active to close your mouth. So this is the answer 21D. Temporalis, masseter, together they see all these muscles have got various functions. So the group for elevation of the mandible is done by temporalis, masseter, medial, pterygoid. So these two will also do retraction. So now we have reached the end of the session. This is me, Dr. Rohini, signing off. So that was the last question we touched upon. So we completed about 21 slides, and we're going to have more sessions like this with the head and neck. So follow me at Row Aqua. It is fun discussing the answers and finding out what are the options we have to pick from. So follow me at Row Aqua and watch out for more MCQs like this every night at 10 p.m. And at 7 p.m. every night, we have a topic-based discussion. And today there was a topic on blood vessels. So blood vessels we had, and blood vessels, third part was it. And the first and second part also is present. Please watch it on the YouTube to get a glimpse of all the three parts. Thank you so much.